My name is Stephanie Ashford. Today's September 25th, and this is my bone video of the axial skeleton. This is the frontal bone, this is the parietal bone, and this is the occipital bone, which contains the external occipital protuberance, which provides stability of the vertebral neck involving the ligaments. This is the temporal bone, which involves the squamous part. This is the temporal mandibular joint where the mandible meets with the temporal bone. Okay. This is the mastoid process. And this posterior to that is the styloid process. And then we have the external acoustic meatus right here. Okay, we're going to talk about the petrous part of the temporal bone, which houses the middle and internal ear cavities. And if I can get close enough, I will show you. This is the petrous part right here. Okay, and this is the internal acoustic meatus, which has the cranial nerves 7 and 8. Okay. Also, this is the superior orbital fissures, are the little holes you see through the eyes. And I'm also going to show you the lesser and greater wing of the sphenoid. Okay, so put it in black, the lower wing, and then the greater wing right here of the sphenoid. Okay. And the superior orbital fissures, the cranial nerves pass through here. Okay, we're also going to show you the optic canal, which is right here, and the optic nerve passes through here. We're also going to show you the sella turcica, which holds the pituitary gland. Also, we're going to show you the crista galli, which is right here, and it helps to really secure the brain in the cranial activity. And then next to that we have the ethmoid bone, and then we have the cremiform plate here, where the olfactory nerves go through there to communicate smell to the brain. Okay, then we have, let's see, the sutures. Okay, so looking at the frontal bone, we have the associated coronal suture. Then we have the sagittal suture that divides the parietal bones. And then we have the occipital bone and the lambdoid suture, and then we have the temporal bone and the squamous suture. Okay, facial bones, we're going to look at the maxilla. Maxilla is here, and the alveolar process are the teeth sockets that hold the teeth in place. We also have the nasal bone here. We have the zygomatic bone and the zygomatic arch here. That's comprised of the zygomatic bone and temporal bone. We have the ethmoid right here where you see the black dot, and the vomer, which is made up of the ethmoid and the palatine bones. So this is the vomer. And superior to that is the inferior nasal concha bone, which kind of divides the nasal septum into lateral walls. Okay, the mandible is here. Then we have the body of the mandible. Then we have the mandibular angle right here. Okay. Then we have the mandibular epicondyle. mandibular notch, and the coronoid process. And then we have the ramus here as well. Okay, we're going to look at the vertebral column, and there's 4 curves comprised of the cervical, lumbar, thoracic, and sacral area. The primary parts are the cervical and lumbar, and the secondary are thoracic and sacral. We have the C1 or atlas bone here, and this articulates with the skull and is responsible for the nodding motion. Okay. In looking at the vertebral column, we do have the transverse process, which are these. This is the transverse process right here. Transverse process. Okay. And what's unique about it is that it has a transverse foramen that provides vertebral arteries that service the brain or communicate with the brain. Okay. Then we have bifid spinous processes right here. And then we have the intervertebral foramen, which the spinal nerves pass through. So let me show you this is the intervertebral disc, and then the foramen right here. Okay. Then we have the body of the intervertebral disc. If I can take one of these out, it would just be the bottom portion, which is the bottom, or which is the body, excuse me. All right, and thoracic altogether has T1 to T12. And then we're going to go over and look at the lumbar vertebrae, which is L1 to L5. It contains the sacrum and the coccyx. So this is the sacrum right here. This is the coccyx right here. Okay, and then we're going to look at the manubrium, which is right here. We have the sternum body here, xiphoid process here, and then we have the jugular notch here. Okay, I'm going to count from 1 to 7, which represent the true ribs. So 1, 2, 3, 4, 5, 6, 7. Those are the true ribs. And then counting further, 8, 9, 10, 11, 12 are the false ribs. And these are also the floating ribs as well. Let's see, head, neck, and tubercle of the rib. This is the head of the rib. This is the neck. So head, and then neck, and then the tubercle. Okay. And then this articulates with the sternum as well. Okay, well, hopefully I didn't miss anything. My name is Stephanie Ashford. Today's date is September 25th, and this concludes my bone video of the axial skeleton. Thank you and have a great day.